Hi friends, welcome to the channel Dinesh. Here we are discussing about Kerala PSC DHS Staff Nurse exam conducted 30th January 2021, provisional answer key. Yesterday we have discussed around 40 questions. So balance question we will discuss here. So those who are not subscribed to our channel, please subscribe and don't forget it. So we'll go to our topic, that is DHS Kerala PSC DHS Staff Nurse exam provisional answer key. Kerala PSC DHS Staff Nurse provisional answer key, second part. First part we discussed yesterday. Before going to start our video, there is information for you, that is Unacademy's IIT JAM revision course. So IIT JAM revision course 2021 includes a comprehensive revision series of free classes that will help you for preparing for upcoming IIT JAM examination, that is in February. So it includes flashcard series, last minute tips and tricks, includes mathematics, that subject will discuss February 6th and 13th February 2021, and topic subject chemistry will discuss same that 6th and 30th February 2021, and physics subjects will discuss same date 6th and 13th, and biotechnology also will discuss on same date 6th and 13th February 2021. Time 10 o'clock morning, 10 o'clock to 10 o'clock evening. And second one, that is daily practice paper series, that includes practice makers preparation perfects, mathematics first February 1st to 13th February 2021, chemistry also 1st to 13th February 2021, physics also same date, physics biotechnology. So all four topics will discuss from 1st to 13th February 2021, time 8 o'clock evening to 10 o'clock. And revision-a-thon, revise-a-thon, a comprehensive revision series, mathematics, chemistry, physics, biotechnology. All the subjects are discussing mathematics on 1st, 5th and 9th February, chemistry 2nd, 6th and 10th, physics 3rd, 7th and 11th, biotechnology 4th, 8th and 12th. Time 10 o'clock morning to 7 o'clock. Then crack the JAM full length test, that is mathematics, physics, chemistry, biotechnology, mathematics, statics. Date, that is from 1st, 6th, 6th and 11th February 2021. Duration 180 minutes. So that is a practice test. So it will be helpful for you, and you can arrange your timings and tips and that exam tips, that and all you can use here. So it will be very helpful for you. That is practice test. Date, please note, 1st February, 6th February and 11th February. And you can enroll for free. So IIT JAM, you can enroll free. You can use IIT JAM 10. So you will get 10% discount. Or you can use my referral code also, that is the nurse page. So same also will give 10% discount. Then another course, that is Concurve the batch for Delhi University and Hyderabad University 2021 MSc Biotechnology entrance examinations. So that course is starting from 1st February 2021, handled by Manaswini Sahu Madam, Meenakshi Rajput Madam, Debashish Sir, and Manisha Pallavi Madam, Ankita Misra Madam. So they are the toppers from previous exams in biotechnology. They will handle your biotechnology course for DU and HCU, Delhi University and Hyderabad University MSc Biotechnology entrance examinations. So course is starting from 1st February 2021. It is a plus subscriptions. You can use my referral code, the nurse page, to get a 10% discount. So yesterday we have discussed 30 to 40 questions. So from 31st question we will discuss here. Which anti-tuberculosis drug cause poor vision and difficulty in color perceptions? Which anti-tuberculosis drug cause poor vision and difficulty in color perception? That is, correct answer is ethambutol. Then 32nd question, the key indicator of maternal nutrition is or are. Correct answer option C, that is maternal weight gain and birth weight of the baby. These are the key indicators of maternal nutrition. 33rd question, how many doses of vitamin A should be given to a child from 9 months of age up to 5 years? The correct answer is 9 doses. So from 9 months, first dose will start. So after that, every 6 months, the baby will get vitamin A doses. So first is in 9 months, second will be 1.5 year, third will be second year, fourth will be 2.5, fifth will be third year, sixth will be 3.5, seven will be 4, and eighth will be 4.5, ninth will be 5 years. So total 9 doses. Next question. Wearing of mask during pandemic is an example of which level of prevention? Correct answer, primary prevention. So there is a confusion here. What is primordial prevention and what is primary prevention? Primordial prevention means preventing the developing of risk factors. Primordial means preventing the developing of risk factors of any disease. Primary prevention means that preventing the existing risk factors. Primary means preventing the existing risk factors of disease, and in the same time, primordial means developing any risk factors. That is the difference between primordial prevention and primary prevention. And 35th question, basic measurement tools in epidemiology are listed below except. Correct answer is average. Then 36th question, which among these are free sensitive vaccines? Which among these are free sensitive vaccine? That is correct answer is DPT, hepatitis B, TT and HPV vaccines. 37th question, what is the proper order of the referral system? What is the proper order of the referral system? Referral system in basic level, that is from starting from sub-center, then PHC, then community health center, then district hospital, then finally medical college. Then 38th question, baby whose birth weight is 3 kg, what is the required weight at the age of 4 years? Correct answer is 16 kg. 16 kg is right answer. So otherwise we can get an approximate weight by calculating weight equal to 2 multiplied by age in years plus 5. So the equation comes 2 multiplied by age in years plus 5. So that here age in years, that is 4 years. So 2 multiplied by 4 plus 9. That is one formula, that is easy formula used to calculate birth weight. Next question, expand the full form of ICTC. ICTC full form is Integrated Counseling and Testing Centers. ICTC means Integrated Counseling and Testing Centers. 40th question, among the following which is not a function of WHO? Correct answer is occupational health. Occupational health is not the function of WHO. Then 41st question, Salem sum tube is used for. Salem sum tube is used for stomach decompression. Another tube used for stomach decompression, that is Levin tube. These are the two tubes used for stomach decompression. Salem sum tube and Levin tube. Then 42nd question, which among the following nursing diagnosis may be applied to an individual who is unable to seek or comprehend opportunities, options or alternative because of distressed emotional and unmotivated state? Correct answer is hopelessness. Next question, name the enzymes assessed during Goik test. Correct answer is peroxidase enzyme. So Goic test is used to find occult blood in the stool. Goic test means that is used to find occult blood in the stool. Normally, when no blood means the reaction will take a longer time. If there is a presence of heme, if there is a presence of heme or blood, the reaction will be fast. Or with the help of presence of heme or peroxidase, the reaction will be fast, and the result will get within seconds. So that is the Goic test used for finding occult blood in the stool. Which of the following vitamin deficiency can produce cardiac and circulatory disturbances? Correct answer, pyridoxine, vitamin B6. Next question, patient care ergonomics is. Patient care ergonomics means practice of designing equipment and work tasks to conform to the capability of the work in relation to the patient care. Then the acronym URGE summarizes the symptoms and criteria for diagnosis of. The acronym URGE summarizes the symptoms and criteria for diagnosis of. That is restless leg syndrome. Restless leg syndrome, the cause is exactly not known. And restless leg syndrome means the disorder characterized by an unpleasant tickling or twitching sensation in the leg muscles when sitting or lying down, which is relieved by moving the legs. So, restless leg syndrome means the disorder characterized by an unpleasant tickling or twitching sensation in the leg muscles when sitting or lying down, which is relieved by moving the legs. That is what restless leg syndrome. The urge that is used for diagnosing the restless leg syndrome. Urge means the U for urge to move limbs, and R means rest or inactivity precipitates or worsens. G means getting up or moving improves sensation, and E means evening or nighttime appearance or worsening. That is a full form of urge. U means urge to move limbs. R means rest or inactivity precipitates or moving or worsen. G means getting up or moving improve sensation, and E means evening or nighttime appearance or worsening. So that is what used for assessing or diagnosing restless leg syndrome. Next question. The ventrogluteal site for IM injection may involve the following. Correct answer, gluteus medius and gluteus minimus muscles. Ventrogluteal site includes gluteus medius and gluteus minimus muscles. Then while assessing Mr. X with Braden scale, the score attained was 8, which that risk of developing pressure sore for Mr. X. So that is very high risk. So if the score is less than 9 means there is a chance of getting bed sore is very high. So I will show you an example. So this is the Braden scale assessment factors, sensory perceptions, and if it is no impairment means patient will get score 4. If slightly limited means patient's score will be 3, very limited. So like that we need to score, and the total score we need to assess. The total score that is more than 18 means patient is there is no risk for uh, bed sore. If patient score is between 15 to 18 means there is a mild risk of bed sore. The score is between 13 to 14 means there is a moderate risk, and the score between 10 to 12 means there is a high risk. If it is the score, if it is less than 9 or less than or equal to 9 means there is a severe risk for getting bed sore. That is what Braden scale. So these are the assessment findings used in scoring used in Braden scale. Sensory perception, moisture, activity, mobility, nutrition, friction and shear. And finally, we need to add the total mass. Then we need to categorize the patient in any of the risk categories. And next one, which among the following can be example of examples of parasomnia? So correct answer is enuresis. Parasomnia means a disorder characterized by abnormal or unusual behavior of the nervous system during sleep. Parasomnia means a disorder characterized by abnormal or unusual behavior of the nervous system during sleep. So one of the example is enuresis. Next question. In flawless positions, the head and trunk are elevated to the. Correct answer is 45 to 60 degree. Flawless position, head and trunk are elevated to 45 to 60 degree. Next question. Phlebistostatic axis is the point at intersection of. Correct answer, mid-axillary line and line drawn from intercostal space. Phlebistostatic axis is the point at intersection of mid-axillary line and line drawn through fourth intercostal space. I will show you the example. So this is a line drawing from mid-axillary line and from fourth intercostal space. So this is the area that is phlebistostatic axis. Phlebistostatic axis means it is the reference point for zeroing the hemodynamic device. The reference point for zeroing the hemodynamic device. Hemodynamic device includes arterial BP monitoring device or central vein pressure CVP monitoring device. So we can position the transducer at the phlebistostatic axis level. Then we can make zeroing. Next question. Tall tended or peaked T wave in ECG indicates. This is very common question in most of the exams. That is, correct answer is hyperkalemia. Hyperkalemia features includes tall tended or peaked T wave in ECG. Next question. Name of the receptors on epidermis that transmit stimuli to the axon through synapse. Correct answer, Merkel's cells. Next question. VAC in vac dressing stands for. VAC in vac dressing stands for vacuum assisted closure. I will show you the vacuum assisted closure device. So this is the example of vacuum assisted closure device. If there is a large open wound means, so we will put one sponge inside the wound and the area or boundaries will close with a plastic covering, or we attach the plastic cover and there will be a tube and it will go to the machine and there is a suction pressure. So this tube will suck out the debris from the wound. So it will make the wound healing faster. That is the purpose of using vacuum assisted closure system. So here one chamber is there. So that debris will collect in this chamber. That is a system of vacuum assisted closure. Next question. Arterial blood gas values showing 7.3, pH 7.3, PaCO2 56 mm of mercury, bicarbonate 24 milliequivalent per liter indicates. Correct answer is uncompensated respiratory acidosis. That is means 7.3 means there is a acidosis. So we need to find out whether it is respiratory or metabolic. For that, we need to check in which parameter there is a changes. So here PaCO2 is 56 mm of mercury. So it is directly indicates respiratory. So we need to check whether it is compensated or uncompensated. So compensated respiratory acidosis means the pH will be always within normal limits. So here it is 7.30. That means it is not in a normal level. So it is a uncompensated respiratory acidosis. Means the acidosis is caused by increased level of PaCO2 or carbon dioxide level. But here bicarbonate level is normal. So it is purely due to respiratory reason, respiratory acidosis, which is uncompensated because the pH value is 7.3. It is not reached to normal level. Then 56 question, on physical examination you were able to identify pulse deficit. It indicates possibility of having. Correct answer is cardiac dysarrhythmias. Next question, administration of mesna with the chemotherapy agent helps in. Correct answer, protecting the cells. Then 58th question, your patient complains of dry mouth with swallowing difficulty. Which among it following drugs can produce these side effects? So correct answer is dicyclomine. Dicyclomine is used for treat irritable bowel syndrome. It is an example of anticholinergic drug or antispasmodic. And the another important point is it is not used for children under the age of 6 years. So main side effects of the dicyclomine includes, one of the side effects includes dry mouth. It is not used in children under 6 years, and it is an example of anticholinergic or antispasmodic and mainly used for the treatment of irritable bowel syndrome. Next question, goniometer is used to assess. Goniometer is used to assess. Correct answer is range of motion. So here there will be a confusion, goniometer and gonioscope. So gonioscope means it is used to measure the fluid drainage through the angle of the eye. So I will show you an example. So goniometer, that is used for assessing the range of motion. The goniometer will be keep here. So any joint we will keep and will assess how much the limbs mobility. That is what the purpose of goniometer. The same time, gonioscope is used to it is a painless examination to you see whether the area where fluid drains out of eye. So usually it is useful to diagnosing glaucoma. So in that angle closure glaucoma, open angle glaucoma, this and all we can diagnose with using gonioscope. Goniometer used for assessing range of motion. Gonioscope for the fluid drainage through eye. And the next question, angle brachial index value less than 0.9 indicates. Angle brachial index value less than 0.9 indicates diminished blood flow or peripheral arterial disease is diagnosed with the angle brachial index. It is less than 0.9 means there is a positive, that is positive result of peripheral arterial disease, PAD. In normal value, before that, angle brachial index means it is a systolic pressure of angle, systolic pressure at angle, which is divided by the systolic pressure at the arm. Systolic pressure at the angle, which is divided by systolic pressure at the arm. So normal value is 1 to 1.4. If in between 0.9 to 1 means that is borderline value. If it is less than, if it is equal to 9 or less than 9 means there is a positive peripheral arterial disease or diminished blood flow is there. That indicates peripheral arterial disease is there. Next question, what is the protein requirement per day for a child with severe burns? Correct answer, 3 grams per kilogram body weight plus 1 gram per total body surface area percentage. Next question, which of the following statement about infant mortality rate or IMR is correct? Correct answer is IMR equal to number of death of children under 1 year of age in a year divided by total live birth in the same year multiplied by 1000. So there is a confusion. 100 also option is there. So correct answer is multiplied by 1000. Next question, in which of the following genetic condition karyotype 47, that is XXY, is seen? Correct answer is Klinefelter's syndrome. Next question. What is the normal serum calcium concentration in human blood? Right answer here 8.5 to 10.5 milligram per deciliter. 65th question. Which of the following vaccine is not included in pentavalent vaccination? Pentavalent vaccination is not included varicella. All other vaccines are included in pentavalent. For pentavalent means for 5 diseases: diphtheria, uh, tetanus, pertussis, Haemophilus influenza, and hepatitis B infections. These are the 5. The pentavalent vaccine is given against these 5 diseases. Next, 66th question. Which of the following disease condition manifests as Koplik spots in buccal mucosa? Correct answer, measles. 67. What is the name of opening that connects 2 atria of the fetal heart? That is foramen ovale. Next, 68th question. Which of the following is recommended volume of enema solution for an infant? Correct answer is 120 to 240 milliliter. Then 17th question. Which of the following group is the target group of weekly iron and folic acid supplementation program, or WIFS? The target group is school going boys and girls, or adolescents boys and girls. Then 71 to 79, 80 question we already discussed in previous video. So 81st question. What is the nurse patient ratio in the ICU? That is 1:1 ratio. 82nd question. Which type of budget describes day-to-day expense of a unit? Correct answer, operating budget. Then 83rd question. Assignment of authority to another person to carry out specific responsibility is known as delegation. In which leadership style the leader takes decision without considering the opinion of followers? That is autocratic. Total power to the leader. Then 85th question. Which ethical principles gives direction regarding telling truth? Correct answer, veracity. 86th question. Getting informed written consent from a preoperative patient comes under legal responsibility, which is type of assignment in which a nurse provides complete care of assigned patients, that is case method used in ICUs and all. Then 88th question. Which inventory control method is based on the cost of the item? That is HML system. HML cost principles of inventory control methods includes mainly ABC analysis, VED analysis, FSN analysis, SDE analysis, HML, just in time. These are the inventory analysis technique. In this main technique, ABC analysis, that is categorizing the inventory things in A, B, C category according to the use of the annual use of the things. In VED analysis, it is applicable for spare parts. It determines the criticality of an item and its effects on production. FSN analysis mainly fast, slow moving and non moving. It is based on frequency of issue or use. Same time, SDE analysis, that is scarce, difficult, easy, based on the lead time required to procure the item. Same time, HML analysis, the inventory listed based on their unit value. That is the answer here. HML analysis. Just in time means materials are purchased and units are produced only as needed to meet actual customer demand. That is what just in time that is used in inventory management. Then 89th question. Which of the following is a principle of management? Correct answer, scalar system. Scalar system means that all supervisors will connect from will connect, and there is to avoid any communication gap between the employees. That is mean scalar chain. Then 90th question. Who introduced the 14 principles of management? Correct answer is Henry Fayol. Next 91 question. By education I mean all round drawing out of the best in child and man. body and spirit. Who stated this? Correct answer, Mahatma Gandhi. Next, which among the following is an example of three-dimensional audio-visual aid? Correct answer, model. Which which of the following is an advantage of lecture method? That is large group of audience. And others are disadvantage of lecture method. This only advantage of lecture method. Then what is andragogy? Andragogy means adult educations. Then 95th question, which is the type of evaluation conducted at the end of the course? That is summative. Summative evaluation will conduct at the end of the course. Formative evaluation will conduct during the course. Next 96th, which of the following is a type of probability sampling? This question we discussed yesterday morning itself. So those who watched that video can score this question. That is systematic sampling. Then which is the variable that is manipulated by the researchers? This also discussed in yesterday morning video. That is nursing research questions and answers video. In that video we discussed this same in that explanations, which is the variable that is manipulated by the research. That is correct answer is independent variable. The 98th question, statement of the predicted relationship between two or more variable, that is hypothesis. Then 99th question, which of the following is a measure of central tendency? So this same question we have discussed in yesterday's morning video, nursing research questions. So correct answer is mean, mode, mean, medium, mode. These are the measures of central tendency. Then last question, which of the following is a design of quantitative research? Correct answer, experimental design. That is a quantitative research. Others are examples of qualitative research. So that is about the answer key of Kerala PSC's DHS staff nurse exam. And some of you asked regarding cut-off marks and all. So there is no actual idea because it depends upon some factors, or it depends mainly the district, those who are selected. And district means the districts like Malappuram, Ernakulam, Kottayam, Calicut, Trivandrum are the high competition districts. So there will be cutoff marks also will be high. So according to me, 45 to 55 will be the cutoff mark, and also it depends upon number of vacancy of each districts. So number of vacancy is not announced exactly. And one more thing, your reservation status. If you have a reservation status, mainly SC, ST, OBC, EWS. So those who have lesser cutoff marks, and usually SC, ST will get a lesser cutoff mark. For OBC and EWSC will have the higher cutoff marks only. And those who are scored more than 55 marks have higher chance for selections. So that is about the cutoff marks, and clear idea we will get in few upcoming days. Yesterday there are some confusion in yesterday's videos answer keys. So regarding IgA, that is natural passive immunity antibody. So in my knowledge, I will give IgG only because in newborn that age is starting from 0, that is at the time of birth, to 28th day. So IgA will give the protections or immunity through breastfeed only. That means first after the birth, a baby need to get adequate breast milk. Then only the antibodies will get from mother. So in between that short time, so till the adequate antibody reaches to baby, the baby already have some immunity power. That immunity power will be due to presence of IgG antibodies. That is why I have given the IgG option there. And one more doubt came there, and that is regarding therapeutic and non-therapeutic techniques. And that is, I think, my option may be wrong. I have given that humor. Humor is the right answer there. So most of you given that is a wrong answer. And what is sympathy? Sympathy will be right. Right answer will come there. So that also confusion is there. So we will wait for the official answer key, official professional answer key. So it will come. Today is Sunday, so maybe tomorrow it will come, or within 5 to 7 days, the official professional answer key will come. So if you have any doubt, or if you have any question, means after announcement of the professional answer key, you can make the complaints. That is a system. Sandhya Rajiv, idea about ESIC notification, I am expecting that is in June, July only. So always your ESIC will take a longer time. IgG will cross placenta, that is right. That is why baby will get immunity from mothers. Newborn. Newborn will get immunity from mother. Cutoff, I already told, it depends upon some factors, that is your selected districts, and if your districts are having high competition or low competition districts includes Kasargod, Wayanad, Idukki and all, that are the low competition districts, and other districts includes Calicut, Ernakulam, Malappuram, Kottayam, Trivandrum. These are the districts having high competitions. So these are the deciding factors of cutoff marks. So 45 to 55, according to me. So it may there will be some slight changes, because most of you having that exam was tough. Apart from 250 candidates, 65 candidates told that it was a tough exam. So apart from 328 votes, around 65 percentage candidates told they were attended around 59 or less than 59 or less questions, because of the questions were tough. And 19 percentage of candidates told it was moderately tough, and only 16 percentage of candidates told exam was easy, because they have attended 70 to 80 questions. Approximate calculation only, based on yesterday's vote. Calicut is one of the high competition districts, so the cutoff will be maybe more than 50 only. NHM answer key. So I will see that one. I didn't get to that question paper. So if you have a question paper, so I will try to make answer key. Abhirami Ammu. So you can send the question paper to my WhatsApp number. So this is my WhatsApp number. You can send questions to Kannur. Kannur, actually, I'm expecting very moderate competition only will be there. Kannur, that is my district. So I think we can stop here. So any other doubt means you can comment. I will try to answer. So if any mistakes means, please pardon me. I cannot say I am 100% right. So I will try to correct my mistakes if it is there means. Kollam also I am expecting a very moderate competition district only. So around 52 cutoff mark is expecting in Kollam also, but it depends. Kottayam, Ernakulam will be Ernakulam is the I think expecting highest cutoff mass around 55 because there are more nurses from Ernakulam, Kottayam, Malappuram. Okay, if you have any doubt means please ask in comment sections. I will try to answer there. Thank you for joining with me. So any mistakes is there means also that also please comment so I can clarify my I can correct my mistakes. And this answer key only for referral purpose only. You can use official answer key for reference for your mark calculations and all. That is what in my knowledge also most of the candidates got that range 45 to 55 range. That is why I kept a cutoff mark between 45 to 55. Bijila, I am expecting Calicut cutoff will be more than 52 to 55. Approximate calculation only based on the that application status and number of candidates accepted that exam. Those who have scored more than 55 means that there is a higher chance to get selection. There is no doubt. Okay, thank you. So tomorrow so after this exam, I think most of you will take some rest, but our video will continue. Tomorrow we will discuss. Tomorrow we will discuss OBG questions and answers. So next DME will come. So you can prepare for DME also. DME, ESIC, NIMANS, all exams will come. So you can restart your study. Alapura, I am expecting around 50-52 only. Alapura districts have moderate competitions. So expecting 50-52 cutoff marks will be there.